Shortly, the Senate will vote on the Paul Amendment, and I want this body to understand why I strongly oppose it. The Paul Amendment, in its essence, has nothing to do with the underlying proposal responding to this enormous COVID-19 crisis. The Paul Amendment is a poison pill that essentially focuses on an old political issue that this body has debated before and very likely is going to debate again. I just don't believe the Paul Amendment has any place in a debate on an emergency coronavirus bill. Every member of this Senate understands our country is facing and dealing with a national health and economic crisis. The country wants us to focus like a laser on emergency measures that can help save lives and keep families from falling into destitution. The Paul Amendment says, in effect, that immigrant families with kids are going to pay for the emergency with their kids' well-being. These families, like so many others, are especially vulnerable at this moment. It's just wrong to bring misery into their homes. I would just ask my colleagues, save the immigration debates for another time when we're not in the middle of a pandemic. Today, the focus is about that pandemic and acting in an emergency where we come together, both political parties, both sides of the aisle. When you're dealing with this kind of pandemic, your focus is helping families and workers, small businesses, all of those people who are walking on an economic tightrope. They're not getting paychecks, is what we're hearing, and they're trying to figure out how to pay their rent. And if they pay the rent, do they have money for food? And if they have money for food, what do they do about out-of-pocket health care? Folks want our support with those survival issues. On the Finance Committee, very pleased to see the distinguished president of this body working with us on the Finance Committee. What we have tried to do is focus on modernizing unemployment insurance. I've said to my colleagues, let's just face it, unemployment and the system for it has been in a time warp. So I think we've got a really important proposal that's going to help an enormous number of people from sea to shining sea. So we need to do so much right now, particularly in terms of saving lives and getting health care to our people. And what I hear from home is people who are following this are saying there's so much to do. Act now, then get on with the additional steps that have to be taken. But for today, get on with it. Get on with passing this bill, getting ready to move to the next bill. Those in need of health care, citizens struggling to make it through these unprecedented times want action now. They all realize that there will be several additional pieces of legislation, hopefully sooner rather than later. But our job today is to make sure we pass this bill, and I urge colleagues, when we vote on the Paul Amendment very shortly, to oppose it, and I yield the floor.